welcome back to the drive home. I need to make sure I have all the mics on.
Lots of mics.
All right. I think I've got
We've got several guests in here with us. So.
I do.
Yeah.
I've got Nikki and Taylor with HSHS St. Anthony's Memorial Hospital.
Hey guys.
Of course, you know.
Hi.
Okay.
Are we on?
I think so.
You need to get
Can you
straight in
really
it.
Close?
Really close. Up a little bit. Now try it.
Hello?
Oh,
Can you hear her?
kind of. I think it's coming through on one of those other mics.
Oh, see, we were having issues with that mic the other day.
Looks like it's just me.
That's fine with me.
Maybe do the old jiggle it method. Yeah, jiggle it a little.
See,
Can you hear me now?
no. I think that mic is not working.
We'll share.
You'll share?
We can share.
All
She
right.
can do most of the talking.
Okay.
All
All
right.
right.
Well, let me just.
I'm going to knock over this.
Oh,
that
you don't want to.
plexiglass thing.
Right,
Yeah, it's
right.
fine. It's good.
So we are here today. I know you're. When I say you're on OT, that means overtime in normal world. But when we say
Yes.
OT in here, because you were at Rotary yesterday
Yep.
and did a fabulous job
Thank you.
at Rotary, and I guess you had a meeting or something to go
I'm
to.
off on Wednesdays.
She's off. Yep.
yeah.
If you can't hear that, she's off Wednesday.
Oh, you're off on Wednesdays?
We gotcha.
Okay, I'm just going to leave your mic on just in case. If
Okay.
It might pop
see,
in.
It's not even.
We can share. I'll
Okay.
sit on Nikki.
So we're talking OT, and we're talking occupational therapy today.
Yeah.
Yes. Yep. So, occupational therapy, we're going to focus on helping patients be more independent with their day-to-day lives. So that may look like a lot of different things. We may focus on strengthening range of motion,
Okay.
usually of the upper body. We could focus on fine motor coordination, or what we call ADLs, or activities of daily living. That would be like getting dressed, something we take for granted. Other people who may experience, for example, like a stroke, those things are a lot more difficult. So making sure that they're able to do those sort of things when they go home, and we are mainly outpatient. So even focusing on those things when they are home, like after going to the hospital or staying at a skilled nursing facility.
Okay. Now, what would a typical treatment? What would it look like? What would it be?
So occupational therapy, it is so broad. So for we have our hand injuries, ortho injuries. Treatment might look like trying to reduce pain, trying to reduce swelling, trying to get some of that range of motion back, strength back, coordination back, and then tying that into what Nikki said into everyday life. So, like, for instance, even if you break a wrist, little things like picking up a coffee mug, cooking yourself a meal, there's just a lot of things that
Curling your hair.
Yes,
Opening
that
a door
you don't
even.
think about. That is hard. Yes.
Yes, I mean,
Turning. The doorknob. So that's kind of the ortho part.
Okay.
Nikki also said that we see a lot of strokes or traumatic brain injuries. So we see anywhere between fine motor coordination, strength, vision, balance, activity tolerance.
And that the vision part is the visual perceptual piece of it. So kind of how our brain perceives what our eyes are actually seeing, like depth perception, things like
Okay,
that.
not your prescription on your glasses. Type
Yes.
of thing.
Yeah,
Okay,
correct.
gotcha.
Yeah, like sometimes when you have a stroke, where the stroke was located at, affects the vision kind of part of your brain, on like the depth perception, figure ground, being able to like locate something in your junk drawer, essentially being able to decipher what is what.
Oh.
So
okay.
we do interventions and treatments to kind of help with that as well.
And another part of OT that I think is kind of special is that we adapt the environment. So we're working with these patients, and maybe they're not going to get everything back. So how are we going to make it possible for them to meet their personal goals? So, for example, the thing that comes to my mind is recently one of the OTs modified, it may have been you, a
No, it
Nerf
was
gun.
Rose.
Okay.
A
So,
Nerf gun?
Yeah.
Yes,
So,
she modified a Nerf gun, so this
Yes.
little boy could shoot it at
Okay.
home.
Okay.
And it was really fun because she would call some of us into the room when they were playing with it, and we would walk in and he would shoot us with his Nerf gun. But he was so happy.
Aw.
yes. And, and even more recently, like I helped to modify the like joystick on the wheelchair. So just by putting a tennis ball, so this
Oh.
person could actually, because he needs to get it replaced essentially, but now
Okay.
he's able short term to use it and move around in his wheelchair. So just any like in the kitchen, there's like different plates, utensils. Think of using stirring something in a pot with one hand, right? That's just
Yeah.
gonna spin. So there's different equipment that could like hold that in place. So you can still do things that are meaningful to you. So OT is all about just meaningful occupations, and that's where the occupations comes in. Anything that anything you do, really. So
That's what I was going to ask. You guys beat me to the punch, but I think you answered most of it. Are there things that can assist, like braces or, grabbers or just things you can put
Yeah.
on your fingers or whatever to help? Is that stuff you have there, or you kind of tell clients how to get them?
both. We, obviously there's so many things and there's
Yeah.
so many things constantly coming out. But we have some things there. So it's called adaptive equipment. So like after a hip replacement, like a sock aid, a long-handled reacher,
Yes.
different things like that. But then there's those things that you don't think about as much. So we don't have everything. But we love researching it and saying, hey, I think that this would be a good idea for you. So yeah, a little bit of both.
And what fits one does not fit everybody.
Right.
So being able to adapt it, figure out, okay, we're going to use this, but how can we make this actually work?
Right.
And so then we also have splinting material, so where we make custom splints as well. So that's something we can make in clinic. So
Variety.
Yep.
All right. It's good to have customization techniques there.
Yes.
Now, are there specialties or certifications for the OTs?
Yes. So we all kind of see a little bit. We do have our certification. So we've
Okay.
been here before where Nikki, myself, and Christy, we all have lymphedema certification.
Oh,
Right.
yeah,
So
yeah.
then Nikki and I are also ASTEM certified. So ASTEM certified is a technique that we use. It's kind of like a deep tissue massage that we use for upper extremity injuries such as like lateral epicondylitis, post wrist fracture, finger fractures. It just helps with scar tissue. It helps with pain. It helps with mobility. So we are certified in that as well. And then we also see pediatrics.
Okay.
So another therapist and myself see pediatrics. So anywhere from birth to, trying to think who oldest one is, like 13 right now. But I think you can,
Okay.
Yeah, that range
as old as probably 18 at times.
Okay.
for the pediatrics.
Yeah, so developmental delays, handwriting, autism.
I was going to ask, I mean, like newborns, I mean, why would you need to see them?
So a lot of newborns are preterm or just a little bit developmentally delayed.
Okay.
So working on like rolling over, working on trying to integrate some of their reflexes, their grasping. So at certain ages, they should be able to hold a rattle, hold their hands together,
Okay.
bring their hands to midline, track objects.
Okay.
And so if they're a little bit behind and the doctor notices it, the parents notice it, they can get therapy services to kind of work on a lot of those developmental milestones.
Okay. Now, I mean, do you need a doctor order for occupational therapy?
Yes.
Okay.
Yep. So primary care physician, pediatrician, ortho doctor. So just a occupational therapy eval and treat for whatever diagnosis is needed.
Okay.
And I also wanted to say we also do aquatics. So we have Jen, who is a certified aquatic therapist for physical therapy. We currently don't have anyone certified in aquatics, but we do see patients. She has additional education in that. So we do that. And that's some kids actually, are they currently, I don't know if we have anybody currently, but I know sometimes
in the
they'll,
summer,
we'll get kids into the pool for therapy,
Yeah.
and that's helpful.
Well, that's a good point. I mean, that brings up one last question I had. You know, we were talking about the items that can assist you with splints and grabbers and tennis balls on joysticks or whatever. But some things it sounds like you also do with, you know, aquatic things, stretching or exercises. Is that a big part of it too, or is it mostly, you know, tools and assists out there?
Oh, no, it's both. I would say it's
everything.
more exercise.
Okay.
So whenever you come in, the first visit will be an evaluation, usually about 60 minutes. We ask a lot of questions.
Yeah.
We take range of motion measurements. We take strength measurements. There's a certain way to measure strength called manual muscle testing. We also check your grip strength and your pinch strength. We use standardized assessments to check your coordination, whether it's gross, which is bigger movements, or fine motor coordination, which is the smaller movements. I would say mainly we do that in outpatient and inpatient, but we always try to bring it back to a functional goal.
Yeah, that's a good point. Right.
Yeah.
Okay.
There's always a goal in mind with all this.
Yes. Yep.
And speaking of that, you hinted at it with the aquatic things that are available. That means everything is at the Richard Workman Sports Complex?
So, yes, we are located at the Richard E. Workman Sports and Wellness Complex here in Effingham. So then we utilize their pool for the aquatic therapy. And then we have our own... I'm not one of the people that go into the pool, but we have our own stuff for the pool that we bring with our patients. Yeah.
Okay.
Sure.
Yeah.
All right. So I guess people can give you a call at the complex, and maybe if they have questions, maybe, you know, whether they need the service or not, or you can direct them into, you know, okay, you need to, you know, contact your pediatrician or your family doctor.
Yeah, absolutely. And if you have any, you know, questions, you can always call us too. Our phone number is 217-347-1243. And our fax number would be 217-347-1558.
Well, thank you, girls. Thank
you.
Nikki and
Thank
Taylor.
you.
I really appreciate you guys coming in today. It's about 17 minutes in front of 5 o'clock. It's in front of 5 o'clock. It's